So, by show of hands in this room, how many people have actually had formal training in peer review? One over here. Two?
Okay.
Two. And there's over 200 people in this room,
Yeah.
I'd suggest. Any comments?
Well, I think the analogy I like to use, and it's perhaps funny or perhaps insensitive, but I mean, basically we're saying to somebody, would you have a look at this paper with no training? Well, what if I said to you, would you have a colonoscopy with somebody who's had no training? And I guarantee you that 99.5% of you would say, no way, thank you. And yet we're willing to have peer review. Somebody may have been funded to do a study, and we're quite prepared to say, we're going to let somebody look at this who's not trained, we're going to trust them. There's something wrong with that model. There's something very, very wrong with that model. And I'm going to spend the next 12 months of my career, I think, trying to see if I can change it a little bit. I have never been able to get a publisher interested in funding. We've developed core competencies for editors, which we've published. We want to develop core competencies for peer reviewers, which is a much, much larger audience. All the publishers say to me, what a good idea. When you've done it, send it to us, we'll use it. But they don't want to fund it.
So, in light of that,
Yeah.
and thinking about the publishing system and your observations here and questions around peer review, do they have a role in health research? And what is, I mean, often you hear them described as gatekeepers of the quality of research. Are we asking too much of our peer reviewers? Or is there something that you think we can do in between to actually realise that expectation?
Yeah. I think it's probably, my sense, it's probably a failure of universities and institutions of higher education. Along with the question that Ed asked about peer review, how many of you have been formally trained in research integrity? Oh, so there's an increasing number of people. That's wonderful. It seems that I teach a graduate level course on publication science, and I think I've done it for a number of years, and I think the students typically say to me, why isn't this mandatory, and why isn't it taught across the whole university? You know, we're teaching about peer review, research integrity, etc. So I think universities have failed. And I work in a very large research institute, and what are they interested in? They're not interested in what I have to say. They're interested in, this researcher has a new molecule, and that new molecule is going to be really important. And when I stand up and ask that researcher, what is the success rate, the translational success rate of taking the molecule to the bedside? Oh, it's less than 1%. So, you know, it's what are universities interested in, what are institutions, and they're interested in molecules, I think.
Yeah. Okay, thank you. Well, the gauntlet's been thrown down for all of us. Zoe, you had a question?
Hi, David. Thank you for that. I loved your presentation, and I think it's been really thought-provoking. And I did put a version of this question on the app, and we asked the question of who's had training in peer review, and there were, I think, 2. But I think, you know, in addition to that, something that I've been thinking about for several years is almost, I would guess, almost every person in this room had some training in critical appraisal. And what I can't work out, haven't been able to work out, is why we don't critically appraise papers pre-publication with the same level of rigour that we do post-publication. And if peer reviewers were using critical appraisal checklists in the same way that we do when we conduct a systematic review, surely that would overcome some of the issues that you're speaking to around reporting?
It's a really good question. And I'm not sure why that doesn't happen. So, if you and I go onto Google or onto Amazon and we're looking at a product, we'll see that that product has been appraised, whether we call it critical appraisal, and maybe we'll think, 3,000 people think this product is good, maybe I feel safe to buy it. And if you look at models like F1000, where you can actually do that, and other journals, they don't seem to do it. And I wonder whether they don't do it because they're not getting anything for doing it. They're not. It's not part of their career advancement or something. And I wonder whether we should be thinking a little bit outside the box about those sorts of issues. And I think critical appraisal may be part of peer review, but it's certainly not all of peer review. So, when we think about patient engagement, like I'm unfortunately leading a breast cancer screening, I have to make sure that the patients we have engaged are objective, are not paid by an activist group, etc. And I think in peer review, we need to actually be able to look at that. And that's why I think open peer review is very, very important. And we can then size up the objectivity of not just critical appraisal, but maybe a peer reviewer has some beef with a paper for a whole variety of reasons.
Thank you. We have plenty of time. I'll just pick up on that one quickly. This idea of open peer review and publication of peer review reports. One thing that's always frustrated me is that that gets published when the manuscript is accepted and published. But the peer review of the manuscripts that get rejected never makes it to the limelight. And oftentimes, the authors might make some changes, they might not, and then they'll send it off to the next journal, and it'll run the gauntlet of the peer reviewers that are invited by the editors. How do we mitigate some of those issues in this whole system?
We need to make everything open. And I think editors and